we see double-digit increases in utilization of our emergency room. But we don't see double-digit increases in the number of people having to be admitted. So that tells me that there's a lot of people coming to our emergency room who don't really need to be there, but they didn't know where else to go. So I would put my energy into primary care, into that concept of closer to home. And certainly IT is a big part of that. We now have a lot of information available, organizing that in a way for consumers to be able to access it.
If you allow people to do their own appointment booking, they do a far better job of it, they feel committed to it, and you can shorten wait times dramatically. If most people who are told they're going to wait 3 or 4 months for an MRI knew that they could go online and book one at 2 in the morning at some other place that runs 24/7, you know, they would do it, and you wouldn't have 3 or 4 month waits.
I think the biggest opportunity is having one integrated core record for each of us as Canadians to better inform our decision making as individuals, which will then also help inform the providers of care with good access to information.
I think pharmacy has a huge contribution to make in terms of not only better use of medications and better quality and value from our use of medications, but has a primary healthcare centre as well. There's clearly benefits in avoiding duplication of therapy. There's advantages in terms of patient safety.
The data is enormously valuable, whether it's looking at which type of care provide the best outcome cost-wise and clinically, looking at patterns, looking at where are the emerging issues are. That all makes a significant contribution, and having data is essential.
This is a huge cultural change. It changes the way clinicians practice. It changes processes.
I would tell you that electronic health records will transform the healthcare system in a revolutionary way, no less than Tommy Douglas's vision did in the 1940s and 50s. It'd make that big of a difference.